Greetings, everybody. Welcome. I am Dr. Iman Maj, the director of the Osher Center, and I would like to welcome you to part two of our Women's Health series titled Nourish and Balance. For those who joined us in the last session, we have a series of three parts. We did part one, today's part two, and then we'll have a part three. I think it would be on May 8th. All the sessions will be recorded and they will be available for free on our website. So please feel free to refer to our website, use it as a resource. We have other recordings there as well. And just for information that we also did Women's Health series last year, and the recordings are on the website available as well. So today I have two of my wonderful colleagues. I have Dr. Debra Bell and Dr. Ann Kennard. They will be talking about stress, hormones, and mind-body connection, restoring balance. For your information, the chat will be open. If you have any questions, please feel free to use the chat option. We will be reviewing the questions and other notes that I have here. For some of you who are familiar with us and some new attendees, the Osher Center at University of Washington is one of the centers across the country. We have 10 centers in the US, and University of Washington, we started in 2018. We have services in 3 different locations. We have acupuncture, naturopathic medicine, and massage. We also offer integrative medicine in primary care. Dr. Bell does it, and also integrative medicine consults. All the information is on our website. In regards to these seminars for public, these seminars are being supported by our dear friend, Dr. Emily Wong, and her family, Cha Chi Ming. So many thanks to the Cha Chi Ming family for supporting these activities. And as I mentioned, there are 10 Osher centers in the US and 1 in Sweden. Collectively, we have the Osher Collaborative that we organize and collaborate together. Now, for the speakers today, our first speaker would be Dr. Bell. Dr. Bell is the Director of the Education at UW Osher Center for Integrative Health. She's board certified in family medicine. She has more than 40 years experience in integrative medicine and is an expert in women's health. Her career has focused on providing integrative medicine in primary care and also integrative medicine consults. Dr. Bell integrates nutrition, lifestyle medicine, mind-body practices, and spiritual well-being as foundations for health. She has expertise in herbal medicine and nutritional therapies and bioidentical hormone replacement therapy. Our next speaker would be Dr. Ann Kennard. Dr. Kennard is triple board certified in obstetrics and gynecology, integrative medicine, and lifestyle medicine. She holds a bachelor's in nutrition. She is clinical herbalist and registered yoga instructor and completed fellowship in integrative and contemplative medicine. Dr. Kennard chairs different committees, including Menopause Committee for the American College of Lifestyle Medicine, and also serves as a national delegate to the ACOG Wellness Committee. She is written curricula for women's health, and she gives speeches nationally and internationally. Welcome both Dr. Bell and Dr. Kennard. I am going to go off camera, and I invite you both to come and join us for your presentation.
Thanks, Iman.
Thank you so much. All right. Well, welcome to our talk on stress hormones and the mind-body connection, restoring balance. We're so glad to put this together for you for a topic that both of us feel really deeply about and are very happy to share about, especially within the context of women's health. I wanted to share this poem with you. This is one of my very favorite poets, Maggie Smith, and she just published a new book of poetry that came out this week. And the whole poem is there on the right side, and I wanted to read this excerpt for you because I felt like it's so well embodied mind-body medicine and the mind-body connection. And she says, "You ask what I'll miss about this life. Everything but cruelty, I think. But you want one specific thing, so here. I'll miss my body. I'll miss its companionship, how it's traveled with me, never leaving me, and by me. I mean my mind, my soul, myself. I don't know what to call it, and besides, my body hasn't traveled with me. I've traveled inside it. Do I wear it, or does it carry me? Is the body a suit or a suitcase?"
And with that, I will say that our format will be that each of us will take a lead on some of these slides. We're going to start with some of the explanations of the stress response and how that relates to hormones, and also how we can manage the stress response. And then we're going to move into doing some experiential things related to how we can manipulate the stress response. And then at the end, if we have time, we'll talk about a little bit about botanical medicine. So we may or may not have time to answer questions, but Dr. Maj will be watching the chat and will let us know if there is something that we need to include that we're missing, and hopefully we'll have some time at the end to answer questions. So again, we'll have this be a little technical, but I'll try and make it interesting and applicable to you. So you may or may not have heard of the term the HPA axis or the HPA ovarian axis. And the HPA refers to the hypothalamic pituitary adrenal and then ovary axis. And this is the connection. This is the true mind-body connection because the hypothalamus and the pituitary are in the brain. The adrenal is the main stress organ, which sits on top of the kidneys. And then the ovaries is the main hormone producer of reproductive hormone-related hormones. And it changes significantly in the span of women's life. So we have this connection of the HPA axis, and this picture is a little complicated, but not really. It really is just showing where the hypothalamus is, and there in the middle of the brain. And this is sort of command central, is the hypothalamus. And the hypothalamus will make a hormone, which are the messengers, and CRH stands for cortisol or corticotropin releasing hormone. And it's sending that to the pituitary, who then says, oh, okay. And then the pituitary makes another messenger, ACTH, which goes to the adrenals, where cortisol is made. And cortisol is one of the primary stress hormones. And we'll see on another slide how this relates to the ovaries. And we will be talking a little bit about the difference between acute versus chronic stress. So this stress response on cortisol is to help the body when there's some kind of emergency. And we often give the example, I have no idea where it started from, but if you are being chased by a saber-toothed tiger and you have to run for your life. And so all of the things that happen in the HPA axis are helping us to run for our life effectively. But acutely, with the saber-toothed tiger behind you, you either make it safely up a tree or across the river, or you die, right? You get eaten by the tiger. So when we have this chronic stress daily, it can create developing some symptoms that are not particularly helpful for us. And you can do the next slide. So the other component that is happening in this stress response is in the autonomic nervous system, both the sympathetic and parasympathetic nervous systems. And again, on this slide, you can see what are the physical changes that happen. The sympathetic nervous system is the fight or flight, and the parasympathetic nervous system we refer to as rest and digest. So what are the different things that we need to run for our life? We need lots of oxygen, so our airways open. We need to get our blood pumped every place, so our heart rate goes up. We do not need to be digesting things, so either the digestive system finishes up and we increase acid and have diarrhea, or everything stops because we have no time for digestion. As we'll talk about a little later, our neurotransmitters might change. because it's not a time to relax, right? We're having a moment of running for our life. And the other thing that happens is the body conserves. So when we have it chronically, we might experience fatigue, and we might wake up in the middle of the night. And in fact, some people have the experience of waking up as if there's a fight or flight response. And so what's important is we're going to talk about the amygdala. And the amygdala is part of the system that is the threat detector. And the amygdala is telling the system there is an emergency happening here. And what we know, though, is that the amygdala is also connected to other aspects of the emotional brain as well as the thinking brain, the cortex. And so we will be talking in a minute about how these mind-body connections have an impact on the amygdala and how our emotional brain has an impact. I think the next one is looking a little bit more at the ovaries. And so those are the names of the hormones that are secreted by the hypothalamus to tell the pituitary, to tell the ovaries, to make estrogen and progesterone. And again, you can see in this picture that these also are connected to the adrenals and cortisol, as well as the autonomic nervous system, which is going to make us norepinephrine and epinephrine. And so anything in our hormones can be affected by this stress response, whether it's a stress response from the amygdala saying there's an emergency, and the amygdala doesn't care whether it's that you think there's an emergency or that the body suddenly is having these physiologic changes. It just sends the message. And this is where our mind-body medicine practices can help us to regulate this signal, which then helps us to regulate cortisol, which then helps us to regulate our hormones. So again, we have a biorhythm, it's called a circadian rhythm of cortisol, that is supposed to naturally go up in the morning, go down when we're sleeping, and that can get disrupted from chronic stress. And as I mentioned before, GABA is a neurotransmitter that helps us to relax. Many people know about the neurotransmitter called serotonin, and these are going to go down in the chronic stress response. And unfortunately, when all this happens, we then can run into this bit of a cycle that the symptoms we have from our stress response create more stress, and now we're stuck, and then that affects our hormones, which gives us symptoms that make more stress. And this leads to slower recovery. So hopefully we're going to talk about some techniques that might be helpful to manipulate this.
Yeah, and I think it's important too to note that stress is from multiple sources. It's really unfortunate that the amygdala can't tell the difference between, the carpool line is jammed and the saber-toothed tiger, but basically it's creating the same physiologic outcome for it. And likewise, it's not just stress of, oh, I feel stressed because this is stressful. It can also be um, pollutants or light or, thinking about sleep, the screens before bed that disrupt the neurobiology that sets us up for good sleep. And then sleep is such a bidirectional thing because, nothing is good if sleep isn't good. But then it's difficult to sleep when any of these things are off. And, um, both Dr. Bell and I take care of a lot of menopausal and perimenopausal women. And what you'll hear over and over is that sleep is one of the first indicators of hormonal shift and drift, and people are feeling that differently. And then in turn, disrupted sleep affects the diurnal cortisol rhythm that Dr. Bell was talking about, that it should be high in the morning, get people up out of bed and ready to go for the day and then taper off during the day. But instead, a lot of people end up with this high or higher cortisol in the evening, that they have this tired but wired feeling. They're tired all day. They're like, today I'm going to bed early. And then, 9 p.m. hits and they're kind of like awake and difficult to settle down. And then it pushes their bedtime back later than they would like to, and they have difficulty getting to sleep. Whereas if the sleep is happening in a more supportive circadian rhythm, that HPA axis will reset overnight. The cortisol should resume a more normalized pattern, which over time affects prolonged stress activation. And so the idea of this too with a hormonal overlap is important because the changes in perimenopause and menopause with estrogen and progesterone, those itself also affect sleep architecture with decreased deep sleep, changes in REM sleep, changes in sleep latency. And that's beyond just the sole interruption from hot flashes at night. It's actually a change in architecture. And so this hormonal overlap too of the cortisol, the changing estrogen and progesterone in sleep is really important during this time. And we see this too with increased sensitivity to stress and decreased buffering, if you will, to stress, slower recovery after stress. The clearance of cortisol is not the same as it was. And, you know, this idea of loss of buffering and stress sensitization, I hear clinically all the time women come in saying, I feel different. I'm just really stressed. Things bother me more. I don't sleep as well. I don't know what's wrong. And it's, of course, people in this age group often have caregiving for children, caregiving for parents. If they work, their career is at a peak. And yet, it's a change in how people feel that's different than their baseline, that's really based in this neurobiology and hormonal change.
Yeah, and I wanted to say a little bit about that also for those who are not perimenopausal and menopausal in terms of hormone changes, because these kinds of messaging and bidirectional is really happening throughout our lifespan. And so people might notice a difference in the length of their menstrual cycle, or how heavy they're bleeding, or how much PMS symptoms they're having related to a physiologic stress response. And I should have said, yes, stress can be, you're sick, you've had surgery, you have chronic pain, but it could be lifestyle things. You smoke, your diet is poor. It could be that you are being affected by poverty or discrimination, relationships in your home. Any of those things can activate the stress response. The amygdala doesn't really distinguish, as Dr. Kennard said, between those things. So I think that that's important, and also that, again, our hormones are constantly changing, and it's normal for them to be changing in this cyclical fashion when we're in our menstrual years, but it still can get out of whack. And I think for some people who have some variants of that, they have PCOS or they have some other things, those also are all going to be affected or potentially affected by this stress response. And the example, I think I might have said it in the last series, but the example of both right when we get our period, that premenstrual time when our hormones are changing, they're going back to their baseline, or in menopause, when they're changing, they're going to a menopausal level. The body's response is something's happening to the hormones. Is there an emergency? And this, in and of itself, can then activate some of these symptoms that Dr. Kennard is describing.
Yeah, thank you. That's important to note that, really looking at this over the whole lifespan for a woman and not just in the perimenopause, menopause years, although it is a time, I think, of, more active change, and often people will notice that.
Yeah. Yeah. There are plenty of people in their menstrual years who don't notice any of those changes, and a lot of people who struggle with the changes in menopause. Okay, with that, I want to give a little introduction about mind-body medicine practices. I'm not a big fan of reading the slides, so you can see that we've listed some different types of mind-body practices. But basically, the methods differ, but what they are all targeting is this connection between conscious, meaning the thinking brain, and unconscious processes between the mind, which is the not conscious, and the brain, or the mind, which is the thinking part, and the brain. And then our physical health, right? So how do we connect those? And we talked about the HPA axis, the autonomic nervous system. The limbic system is often referred to as the emotional brain. And this is and it's the subcortical brain. This is more of unconscious processes, right? But we become aware of them. So the limbic system does have some direct input to the thinking brain, to the conscious processes of the cerebral cortex. And that's where this awareness part comes in. And what we can use in mindfulness practices is actually cultivating this awareness so that we can begin to notice and make changes based on this connection between the limbic system and the cortex, which then will have an impact on these stress responses. And we know, in fact, that meditation practice, this is from scientific studies, actually reduces the activity of the amygdala, right? So people do these awake MRIs and look at people's amygdala, and the amygdala does not light up as much in people who have been practicing regular meditation. And so, what the amygdala, again, it's not very good at making any kind of decision about what the stress response is. It's just saying, red alert, turn on the emergency system. And what mindfulness practice and these awareness practices do is it helps the brain to process the difference between a perceived threat, meaning that there is some kind of emotional habit or past experience or anxiety about something that the brain thinks that there is a problem, or even just my hormones have shifted and that's actually normal, but my brain is thinking that it's a problem, versus an actual, real immediate threat, like I'm being chased by a saber-toothed tiger, or don't step off the curb, there's a car coming, or, don't touch the hot stove without your, pot holder in your hand. Those are real threats versus our perceived threats. And these techniques can help us with that. I think I will go ahead and say a little difference between the relaxation response, the stress response, and what mindfulness practice does, which is enhancing attention and awareness. They all are very much related, and by doing any kind of focused activity, we are engaging a little bit mindfully, but they're a little bit different in that the relaxation response actually activates a sensation that people feel. Their muscles are relaxed or they feel relaxed. Some people feel like stress reduction techniques are supposed to do that, and sometimes you do feel a little more grounded, relaxed. But in fact, it's that they're trying to find a balance between this sympathetic and parasympathetic nervous system. They're activating this parasympathetic nervous system. So that's what the point of the stress reduction technique. And mindfulness practices are actually working with the mind to help us to develop awareness and attentiveness. And there is a little bit of I would say, misinformation about this notion of mindfulness practices and meditation quieting our mind. You can't quiet the human mind. The human mind is just full of stimuli all the time. Even when we're sleeping, the limbic system, is active. So really, again, the point is to help the mind to filter through all of these perceptions to enhance awareness and attentiveness of what's happening in the present moment of reality.
I think of it as becoming an observer of thoughts rather than a thinker of thoughts.
That's a great, great brief way to say it. And so what we know, again, is that amygdala activity goes down, cortisol regulates, and we increase this parasympathetic tone. Okay, so let's move into some practices. And Dr. Kennard and I are going to alternate who's leading them. So abdominal breathing exercises are a stress reduction technique. They are not specifically a relaxation exercise. And as I said, because we are focusing on some things, they provide us with a little bit of mindfulness, but they are not specifically a mindfulness practice. So why does abdominal breathing a stress reduction technique? Well, part of the parasympathetic nervous system is the vagus nerve, and it travels along the esophagus and it goes through the diaphragm and then back to the spinal cord through the parasympathetic nervous system. And so the diaphragm in abdominal breathing is moving down to fill up our lungs. Our abdomen goes out, which stimulates the vagus nerve. And then in abdominal breathing exercises, we have a prolonged exhalation. So as the diaphragm is coming back up, we also are having stimulation of the vagus nerve. So we're activating the parasympathetic nervous system by doing abdominal breathing exercises. And there are many different kinds. There's box breathing, there's 3-3-3, there's 6 and 6, there's lots of them. But I'm going to have us do a technique called 4-7-8 breathing, which has been popularized by Dr. Andrew Weil, who is a renowned integrative medicine physician. So some people, when they are doing this exercise, like to place one hand on their chest and one hand on their abdomen so that they noticing their abdomen is moving in and out, or they put both hands on their abdomen and see that their hands are separating as their abdomen moves. You can have the image of balloons in filling up. And again, it's in your abdomen, not in your chest. I like to think about a bellows, that it's opening, filling, and then closing. The other thing that's on this slide is just another form of abdominal breathing. It's a little bit more of a mindfulness practice. So in order to take an abdominal breath, we need to have posture for that. And so most of the time, having your legs flat on the floor or straight out in front of you instead of crossed. And again, your hands, you want to have your hands relaxed. You could have them on your belly or your chest and belly, or you could just have them relaxed in your lap. You just don't want them clenched in any way. And the spine should be straight. I like the image of the spine like a big rope attached to the base of your skull. It's just hanging. It's not taut. It's not curvy. You can have your eyes closed if you're comfortable with that. If for some reason that is difficult for you, we talk about an unfocused gaze where you're just looking about 3 feet in front of you. If you're looking straight ahead, there's too much stimuli from your vision to help you to distract you. So I'm going to talk us through this. We are going to breathe in through our nose for a count of 4, hold our breath for a count of 7, and exhale for a count of 8 through our mouth 4 times. And Dr. Weil's recommendation is to do at least a series of 4, 4-7-8, 4-7-8, 4-7-8, 4-7-8, twice a day. And research shows that this helps to regulate our cortisol system. So I invite you to find a comfortable position in your chair with your feet on the floor. Your spine is comfortably straight and your hands are relaxed on your lap or on your lower abdomen. And I'm going to have my eyes closed. You can put the tip of your tongue at the top of your palate if you'd like to connect the Eastern medicine cycles, or just have your mouth closed. You're going to breathe in through your nose for a count of 4. So we breathe in, 2, 3, 4. Hold your breath, 2, 3, 4, 5, 6, 7. And exhale through your mouth, 2, 3, 4, 5, 6, 7, 8. And inhale, feeling your lungs fill. Hold your breath. And exhale through your mouth, letting all the air out. And now inhale. Hold your breath. And exhale. Inhale. Hold your breath. Exhale. And that's 4 cycles. Welcome you to open your eyes, come back. And that is an example of 4-7-8 breathing, a stress reduction technique.
I feel better after that. Thank you. I'm going to talk about yoga, and I love teaching yoga, and one of the things I love about it is it combines movement and breath. And so for some folks, that seated meditation practice feels difficult. They feel like their body or their mind is too active for that. Sometimes yoga is a gateway into allowing this harmony, if you will, of a mind-body practice, but still having that movement. And just like Dr. Bell said, in terms of outcomes, we see decreased cortisol, increased in relaxation hormones. People that practice yoga regularly on those fMRIs show an increase of matter in the frontal lobes and away from the fight-flight response in the midbrain. And I love teaching restorative yoga in particular. And I love the idea that yoga is for every body, right? There's not one body that fits yoga or a yoga type, and you don't have to be flexible. And it doesn't need to be long or something that you go for a class for, but simply linking the movement to the breath in some capacity with these different postures or stretches is enough to confer all of these physiologic changes and benefits. And so this is one that I like when I've been seated for a while, and something I'll do with colleagues as well. And it works too for folks that, you know, are mostly seated in their lives and can be helpful with that. And so starting with a hand on each knee and inhaling as you move your body in a circle, and exhaling, starting to get some movement in the hips and the spine. If you're familiar with it, you can start to add some element of a cat-cow pose. So as you come forward, the spine extends forward. As you come back, it rounds like a cat. Inhaling for extension, exhaling, rounding for cat, and going the other way. Noticing where the breath is in the body, if it's up in the chest, in the abdomen. I like to focus too on trying to bring the breath more to the back body too, and allowing the breath to almost have a massage-like quality in the body, bringing its own energy. And then coming back to center and taking the right hand onto the left knee, inhaling a long spine, and exhaling to twist. And then inhaling again, coming out just a little to where your lungs and your belly can fully fill with air. And then exhaling to twist again. We'll do that one more time. And coming back to center, to the other side, left hand on right knee, inhaling long spine, shoulders away from the ears, exhaling, turning to the right to twist. And inhaling again, exhaling to twist. And one more time, inhaling and exhaling, and then coming back to center. And then taking the right ankle over just above the left knee. So not on the knee joint itself, but just at the bottom of the upper leg, bottom of the femur. And the left foot is down on the ground. And this is a very gentle chair pose. So you can stay here if that's enough. You can take your right hand and gently press the right knee outwards. Again, not on the knee joint, but just above it, keeping the right foot flexed to protect the knee. Or if you'd like a little bit more stretch, then starting to lean forward here into that seated pose here. It mimics a figure 4 on the back or a pigeon pose on the floor. Really nice for the tight hips and butt muscles from prolonged sitting. And then taking the other side, so the left ankle is going just above the right knee. The right foot is on the ground. The left ankle is flexed back to protect the knee, and either gently pushing the left knee outwards a bit, which you may feel, or if you need more of a stretch, then leaning forward. And just like we did with the twist, inhaling brings you up out of it just a little bit. Feel the air expand the chest, expand the belly. You'll feel your belly expand on the thighs if you're leaning forward at all. And then exhale to lean forward, keeping the shoulders relaxed away from the ears and linking that breath to movement. Inhale and exhale, feeling the subtle differences in the body as it gets used to that stretch and moves forward. And then letting that go, both feet back on the ground. You can give your hips a little bit of a wiggle. The spine is long. And noticing if the breath feels like it's different, if it's easier, if it's living in a different place in the body, maybe a little bit further down in the torso, in the abdomen. And thank you for joining me for that brief chair yoga practice.
Thanks, Anne. That was awesome. Appreciate that. Okay, I'm going to take on mindfulness. We're going to do a little bit of a mindfulness exercise, but do know that mindfulness practices can be above and beyond meditation. There's lots of different forms of meditation. There's just silence, there's guided meditations, but we can have other mindfulness practices, mindful eating, mindfulness of everyday life, walking meditations, things related to the arts, journaling, creativity, etc. A couple things about meditation practice that I want to say, and then we'll do our practice. There are only a few rules. One is you can't do it wrong. Two is it's a process. And three is, well, maybe this is a double. It's coming from a place of no judgment and a place of self-compassion. So again, when we're doing this practice, it would be great to have a comfortable position in the chair, and I'll invite you that at the beginning. And what I'm going to do for meditation is that oftentimes many meditation practices will have what we call an anchor. And the imagery that I like for this is that if you're on a boat and you put the anchor in, if the boat starts drifting away, the anchor just gently brings you back to your center place. And that is what the anchor does for us in meditation. And the anchor can be a word, and it really can be any word. Many people will pick a word that's meaningful for them, but my husband and I have run a lot of meditation retreats, and he often says, you can just say porcupine, whatever you want. It's just something that's your anchor. But oftentimes we use the breath as our anchor because the breath is something that will happen whether we are thinking about it or not. So this meditation, I'm going to use the breath as the anchor, but I invite you, if you would prefer to use a word or some kind of image. Some people use the word thinking as their anchor, that their mind is just carrying off. Thinking allows you to recognize the awareness that you're just full of thoughts and brings you back to your place sitting in the chair. I have a little script for this, so I'm going to turn off my camera and invite you to look at this beautiful picture of sunset outside my window in the Pacific Northwest. Or you can close your eyes if you feel comfortable with doing that. Okay. So Allow yourself to find a comfortable position in your chair. Notice your feet on the ground. If your legs are crossed, gently uncross them so that both feet are touching the ground. Notice the bend in your legs, your bottom touching the chair. Notice your hands resting in your lap. Notice your head, neck, and spine aligned comfortably. And sit in a position that feels just right for you. If you're comfortable with closing your eyes, I invite you to do that. And now, bring your attention to the fact that you are breathing, becoming aware of the movement of the breath as it enters your body and as it leaves your body. Not manipulating your breath in any way, as we did previously. Not trying to change it. Simply being aware of the breath. Notice for the next few minutes or moments your inhalation and your exhalation, giving it full attention and care for each in-breath and each out-breath as they flow one after another. You're not trying to do anything, and you're not trying to get any place or get something done. Simply being present with each breath that you take. You may notice from time to time your mind wanders off into thoughts of the past, anticipations of the future, planning, worrying, whatever. But as soon as you become aware that your attention is no longer following your breath, without giving yourself a hard time, simply escort your attention, your focus, back to your breath, the in-breath and the out-breath. If thoughts come and let them go. Just coming back to your breath. And now, at your own pace, when you feel ready, slowly and gently bring your attention and your focus back to where you are, feeling your body in the chair, maybe moving your fingers and toes, and allow yourself to open your eyes.
Lovely. Thank you. All right. I just need to figure that out for a moment. Okay, back to the slides. So I wanted to talk about somatic therapies, and there's a number of them out there, and to an extent, yoga is one in terms of the awareness and the sensation of body. And somatic experiencing is another, and neurogenic tremor. There's a lot out there, but basically they all come down to the idea that the body and mind are linked and that trauma is often stored and processed in the body, and that the body needs to be involved to process that stress, and repatterning the stress response. And I think for a lot of people that live in a very disembodied way, and I would include, my experience personally going through medical school and residency, that's a time that, you're very unresponsive to your own needs, or even perhaps unaware. And that this sort of practice brings that awareness forth, the felt sense, as it were, of your body. And so for people that have chronic pain, they have a lot of somatic symptoms, abdominal pain, headaches, things like that. Some gentle awareness of the body can be very helpful in terms of starting to address that, not only from a holistic perspective, but from a mind-body perspective, moving towards a more balanced nervous system regulation and tracking sensations. And so what I'd like to invite you to do here is, whereas mindfulness has that anchor dropped and brings us back, 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 back again with that sense of non-judgment and self-compassion, this invites us into a felt sense of something that you're experiencing in your body. And that can be neutral, negative, positive, but it brings your awareness into something in the body. And so I'll cue for the shoulder and neck, but please insert whatever would be appropriate for you. And so for this, starting to become aware of your shoulders and your neck, and if there's any felt sense of sensation there. Is it warm? Is it cool? Is it neutral? Do you have a sense of tension or relaxation? If you have a sense of tension, can you identify an origin of the tension? Can you imagine that the shoulders are becoming warm and slipping back down into their shoulder girdles away from the ears? Notice what the jaw is doing. Is the tongue on the roof of the mouth? What is the felt sense of this, the head and the scalp and the orb of the entire head? If there's any tension, see if it can be let go, even just 10%. Maybe give the jaw a little wiggle. Let the tongue relax in the mouth. Let the teeth part slightly. The lips are soft, vacation lips, as it were. Noticing even how this awareness of felt sense in the body and these very slight adjustments create a different felt sense overall of the experience of the head and neck and shoulders on your body. And with this, you'll notice this can be continued into a self-guided relaxation throughout the body. But even it doesn't need to be that you're doing or changing anything, but the awareness starting to penetrate of the body. And if something feels uncomfortable or too much, looking at something that feels neutral or good as a resource for starting to titrate the experience of something that doesn't feel good. And so That is an example of a somatic therapy, and I think it really overlaps well with mindfulness and yoga, but I wanted to mention it as its own entity as well, because I think it's a very powerful tool, especially for women that we're asked so much in life and have 400 tabs open, if you will, and are doing a lot. And so the practice of coming back to our own bodies and our own needs, I think is very powerful medicine.
Yeah, this is also a really good tool, I think, for people, as well as 4-7-8 breathing. If you're having trouble sleeping, is just to really allow yourself to feel the weight of your body on the bed, and all of the cues that Dr. Kennard mentioned. It's a nice connection. And from a mindfulness practice, if we are focusing our attention on that, it sometimes helps us to let go of some of the attachments of the ruminating thoughts.
I wanted to speak briefly on social relationships because I think it's under talked about in terms of mind-body connection and mind-body medicine. And that is the people that you spend time with really make a big difference in terms of nervous system stability and co-regulation with that other person. The oxytocin, that bonding hormone, um, is real. And so in lifestyle medicine, we talk about social relationships as being one of the very strongest predictors of health and longevity. And this is why, and I think it deserves a place in a mind body talk, because this isn't in a vacuum. We can breathe ourselves all we want, but if there's chronic stress within the household or other relationships, uh, that needs to be addressed. And while those therapies do allow us our own resource for managing those things and addressing them from a place of resource within ourselves, thinking holistically about mind body medicine should include the others in our lives. And then physical activity. This is a busy slide, but I'll be brief about it. Physical activity is a huge regulator of the HPA axis. It keeps the pituitary and the hypothalamus healthy in terms of their hormonal production. It keeps the cortisol diurnal rhythm healthy. It matters too, from a circadian perspective. It seems like exercise done earlier in the day, or at least by about 4 p.m., is much better in terms of regulating that. And it improves the HPA axis flexibility and recovery if someone has been undergoing chronic stress. Even a pretty small amount of exercise, like 20 minutes of a mild to moderate aerobic exercise like walking or body weight, strength training, yoga, something like that, reduces that chronic cortisol elevation and the effects of stress on the body, i.e., the allostatic load. And it's one of the strongest predictors of improvement of sleep, especially exercise done earlier in the day, that reset of the circadian rhythm, and improving not only the onset of sleep, but sleep architecture, deep sleep, REM sleep, and has nervous system effects over time. And then we wanted to talk about adaptogens. So we're both very into botanical medicine.
Are we gonna take the lead on talking about adaptogens, and I'll do Nervine's
Yeah,
answer?
you're right. So adaptogens, thanks. Um, are There's such an interesting class of plants because we're used to medicines that, turn this on or turn that off or do this or do that. And plants often behave differently. And this group of adaptogens are botanicals that nudge the body towards the center. They make the body work the way it is supposed to. And so rather than having, one thing turn on or off, it makes the body restore physiologic balance. And we see that with resistance to stress. And mostly this is working on the HPA axis in terms of adaptogens, although across multiple systems, because when you affect the HPA axis, you're already affecting the autonomic nervous system, you're affecting the immune health, the metabolic pathways, and contributing to more long stream regulation over time. And so there's lots of adaptogens out there. I put several at the bottom as examples, and some of them work on being more relaxing, some are more activating that are good for fatigue. So something like ashwagandha, which I'm going to talk about, is nice in the evening. It promotes relaxation and sleep. It nudges that cortisol release back to being more what it should. Something like rhodiola or ginseng is more activating. That's going to be something that gives people more energy. Eleuthero, Tulsi are kind of in the middle. Schisandra is an interesting one, all 5 flavors, and used in Chinese medicine and in menopause in particular. But I really like ashwagandha. I wanted to bring that one to light. It's becoming a lot more popular. I see it a lot on social media. And you see the name Withania somnifera, the somnifera to sleep. This is an Ayurvedic herb, a root. It's been used for millennia. One of the nice things about it is most of the products out there use a standardized extract called KSM 66. And so brand matters less with the supplement than it does with many because of the use of that standardized extract. And over time, you see that improvement in normalized cortisol rhythms to where it's spiking up in the morning and then coming down in the day as it should, rather than that flat line or that increase in the evening that contributes to that tired or wired feeling. And because of that, you see improvements in anxiety, improvements in sleep over time. Some improvements, this is more recent data on cognitive function, which is a common concern and change noted in the menopausal transition in terms of general memory and information processing, maybe some help too, minor, in the thyroid that's not quite working as it should with subclinical hypothyroidism. This is the dose. I usually recommend 600 milligrams in the evening of the standardized extract, and appears to be safe over time, and I think can be alongside exercise and sleep and the mind-body practices that we've talked about today, can be a powerful adjunct in terms of the mind-body connection and the holistic care of stress.
Okay, and I want to make sure that we end on time, so I'm going to just talk very briefly about the nervines, which are, along with the adaptogens, just very helpful. The nervines are ones that are just going to help to regulate the nervous system, which then, of course, is going to regulate the stress response and also help with sleep. And we've listed a bunch of them at the bottom. And my favorite is passion flower. And for anybody who has seen a passion flower blooming, it is the most lovely, calming thing to look at, in my opinion. Passion flower is quite effective as a tea. There are lots of different commercial kinds of tea. Also, you can get it as either a liquid extract or it can be encapsulated. It's a long history of use. We have a lot of data for it helping with anxiety and sleep, and also with pre-procedural anxiety. I've had some people use some drops of passion flower before a procedure to help them relax. I use it before I go to the dentist. I do like the drops because you can titrate up and down. The nervines are not necessarily sedating, they're calming, but sometimes at higher doses and with different people, they are sedating. And the nice thing about the liquid extract is then you can see what works best for you. And I think we want to put up the last slide before we close, from Carolyn, which we'll talk about our next presentation, which is in May, and will be, you need to register individually for these one this time, and also welcoming any donations to help us to continue with these kinds of activities.
Wonderful. Thank you both. It was a very fascinating presentation. I really enjoyed the practices that we did together. So thank you so much for incorporating this experiential part into it. And yes, as Dr. Bell mentioned, that we will have a part 3 we'll be talking a little bit about constitutional eating. What does it mean? Every body type is different, and based on the body type, then the metabolism would be different. And what does that really mean and translate into our eating habits? So that would be on May 8th at the same time. And yes, we appreciate any donations that you might have for us. Now, with that being said, question. So, thank you for, is it Ami? Did I pronounce it correctly? That they put the link for the breathing techniques, 478. I shared the link with everybody. It's a YouTube, so thank you for that. Now, there's a question regarding this stretching that we do through yoga. So, if somebody wants to do stretching for their hips, and let's say they have a bigger body type, and how can we modify this raising the leg, considering that it could be a big belly kind of interfering with the movement? So, any other modification of the exercises or stretches that you could share with us?
Yeah, thank you for that question. And sometimes it comes up too with a lack of flexibility, like bringing the ankle to the knee, that's not possible. I used to teach chair yoga for very high risk pregnancy, and I had a number of patients that had quads or even quints with very large bellies. And so this became an issue for that. And in that case, one of the things that can be helpful is one, you can bring the ankle up as far as it will go, and sometimes that's enough. But moving it instead to even different hip stretches, not everything is a fit for every body. Sometimes people will do better if they lay on the floor and do a figure four with the same thing, and then the belly isn't upright and kind of coming into the way. Sometimes that helps too if there's a recumbency, like a couple pillows under the back, and then bringing that up to where the the left leg is not at a 90-degree, rather it's much more stretched out to where that isn't quite as sharp of an angle. And that seems to work. And two, just playing around with finding what works in your own body, finding what feels good. It doesn't need to look a particular way to be right.
Yes, yes, thank you. Thank you. That is actually an excellent point that, when we do these exercises, the idea is the movement itself, being present and doing the movement, not necessarily that I need to get my knee into 90 degrees. It's not getting to the 90 degrees. It's causing me more anxiety and stress. Everybody else is doing it. So no, it's kind of like being present and doing it what feels right and just following the flow. That's something that really matters. And there is no judgment here, including, we all have a lot of self-judgment that, oh, I'm not doing it right. I should be doing it better. I should do a better job. I think that the message here is that we do it in different ways as long as we are doing it.
Mhm.
Now, I have a question for you regarding the adaptogens. So, the way that we have learned about adaptogens is that they build resilience. So, they help us with lowering the cortisol in the body and kind of calming down this fight and flight response that we have in the body. My question is the long-term use of the adaptogens. Is there any contraindication that we should not be using the long-term adaptogens?
Well, I'll be curious to Dr. Bell's um, perspective on this too, because what has been historically done is different than what's done in the studies. And so the studies will typically cut off, between 3 and 6 months and really not comment on long-term data. And it is an interesting question because if you're changing a hormonal milieu, and some of this has partial receptor activity, and so, does that change it over time? But I think one of the most important ways to evaluate botanical medicine is by how the people that traditionally used it for hundreds or thousands of years. And in the case of adaptogens, one example that was on the slide was maca. That's a nutritive root that's used in the Peruvian highlands for libido, for strength, for vitality, and it's used as a food, and it's used in an everyday capacity and for people in midlife and beyond. And so I think looking for each of them at how they were used traditionally provides a lot of wisdom, and for me provides reassurance on it. I think people have different opinions on this. I don't personally worry about long-term use of ashwagandha, although it's not strictly studied in a Western sense.
Yeah, I mean, I completely agree. My feeling is that some of the, safety comments are, it's safe for 6 months. And the only reason that that is stated is because the longest Western study we have is for 6 months, and not because we have some kind of evidence that there's a problem after that. And if you look at things, again, historically and from ancient wisdom, we can learn a lot from that. I will say, and I agree with you, and that how we didn't have encapsulated high potency extracts 1,000 years ago of ashwagandha, so that we do have to recognize that we're using it medicinally a little differently in modern times than how it was used in ancient wisdom. So to me, this is again where the mindfulness component comes into play of how am I feeling, how am I doing. Do I want to see how I feel with less ashwagandha, without ashwagandha? And then it's always good to be checking in with yourself and also with your integrative medicine practitioner about what are my next steps. And that for some people, their constitution, their life situation, they really do best when they have the support of an adaptogen, helping the body to adapt to change. And other people, it's just that there is a dramatic time of change or dramatic symptoms. And over time, the adaptogen is very helpful, but maybe after 6 months or a year, it's not necessary. For many people in menopause, these symptoms continue for years. And as long as the person is continuing to have a positive response from the use of their adaptogen, I see no harm, nor do we have any evidence of there being any harm with continued use.
Okay, wonderful. Thank you. Now, the next question that I have here is regarding the mixing of these herbs together. Like sometimes you go out, you want to buy a drop or liquid or elixir or something, and you see they have put like 10 different things into it. So for adaptogens, some of them, for example, you mentioned maca and rhodiola kind of more activating, and then you have Shisandra and ashwagandha more calming, and they could be combined in one tincture that you're buying them. So what are your thoughts about this mixing of these different herbs?
I think there's a
Um,
lot of thoughtful herb formulation.
Yeah, I mean, I talk about some of these products. I say it's like this is the garbage can of every possible herb you could think of in this category, all mixed together. And those are usually not as helpful. Um, excuse me, I do think that herbs do work synergistically together, so that sometimes having combinations of herbs is actually very helpful. For instance, with the Nervines, you can combine lemon balm, skullcap, and passion flower so that actually you have more of a calming effect and less of a sedating effect. Or if you want more of a sedating effect, you might add kava, etc. So I think that the combination part is where the integrative medicine expert can be helpful in guiding people. And that, if there are a few things combined, it's reasonable to try something if you're trying to do self-care on your own first. But if you're not getting the response you want, or you're feeling a negative response, you should listen to that and not continue. Some people think, oh, I didn't sleep well for the first couple nights, but maybe it's going to get better. It's like, no, if you notice that there's a difference, that you're not sleeping well when you're taking your adaptogen, then you need to be changing that. So that would be my answer about that.
I would add
So
too that it's a question of dose, and when they put in 10 herbs, there's not that much of each of them. And the way the labeling is in the US, it doesn't require that each individual dose of each individual herb is labeled. You can say it's a proprietary blend of, 1 gram of 10 things, but you don't know exactly what. And, it's like taking 20 milligrams of ibuprofen and it doesn't fix your headache. Well, nobody would expect it to, and so the dose is really important. And in that case, I do often favor singular herbs to where you have control and knowledge of the dose, and then you can put them together if you want the action of multiple herbs. But I think that that's an important point, is to know what you're getting.
Hmm. Yeah.
Wonderful. Thank you. Now, we have a question here regarding the interaction between adaptogens and other botanicals with medication. So it's a very big topic, but if you were to kind of give it a 30-second to 45-second response, what would your response be?
Each one of the adaptogens we listed would be different, so it is complicated. I think with regards to ashwagandha, um, there are like theoretical interactions, and then there are interactions that are actually contraindicated. There are some theoretical interactions that ashwagandha as an immune supporter might not be good for people who are on immune modulating medications, people who are on autoimmune disease, who are taking medications for autoimmune disease. I don't know that we actually have enough evidence to say absolutely ashwagandha is unsafe. But again, that would be something that you would use under the guidance of an expert and not trying things on your own.
And looking things up, like for specific medication interactions and things like that, there's some good resources. The Natural Medicines Database is one. The resource through Memorial Sloan Kettering is another. They're not perfect, but if you have specific concerns about a supplement you're on or want to take in a medication, that can be a good place to start.
Yeah, the Natural Medicines Database is subscription if you're not, part of an academic center. But the Sloan Kettering one, it's very, very cautious and conservative. So if they're saying it's okay, it is okay. And they have a really lovely patient forward, community forward database around herbs.
Okay,
There's
wonderful.
also a couple of other botanical society databases that they have a little less information about interactions with medication, but there is some.
So Sloan Kettering would be the first to go to. And from there, I wanted to actually talk about ChatGPT. What are your thoughts about chat nowadays? Everybody's got ChatGPT.
I almost said
Just
something
punch it
because
into
most of the time
ChatGPT,
it
and whatever
has,
it feeds me, would it be accurate?
yeah.
We might have differing opinions. So, Anne, if you want to go first.
Well, yeah, I mean, most of the time it's pretty good, but you have to know something to know if it's not right.
Yeah.
And that's where the rub is, right?
Well,
Yes.
and my
That's the
my
right question.
concerns, yeah,
Yes.
my concerns about people using it for medical advice is that it does not individualize at all. And and it also makes stuff up, right? I mean, so I think that ChatGPT does hallucinate, and if you don't ask the question very, very specifically, it can interpret something and then just say something that's not accurate for the person. So I really recommend against people taking medical advice from ChatGPT. It'd be one thing if you want to, ask a question to try and learn more about something, and you just need to remember that it's telling you everything it finds on the internet, which much of that might not apply to you.
Or be
Thank
correct.
you. Yeah, there was a time with Google and now with ChatGPT. So, yeah, but I think it's a cautionary point is that yes, it might have some good guidance, but still it's an infancy. So and as you said, Dr. Bell, it goes and hallucinates based on the response that it creates, and it takes its own response as a reality and a valid response. So um, as a point to start with, fine, but maybe we should go to Sloan Catering and kind of like making sure, or talk to somebody who can guide us.
Or
Great.
if you
So that
want to
brings
use
us,
AI, something like open evidence can be
Yes, open
Better.
evidence is, I think it's for providers. So
Yeah,
they
you
have
have
to,
you have to have a license to.
you have to be, yeah, you have to have a license to practice, but open evidence is great.
Yeah.
Great, wonderful. Thank you so much. It was a very informative presentation. I hope that our attendees really enjoyed it and we all have something to take home with us. And with that, wish everybody a lovely weekend and take good care, everybody.
Thanks.
Thank you.
Bye, everyone.